So,
just a minute, Dr.
yes.
I'm lost in your response because we want to move a little bit fast. The question is saying, explain why CHPs in Nairobi have not received essential personal protective gear such as gloves, raincoat, gumboots, and masks necessary for their safety and professional work. Chair, address yourself to that.
Chair, what if the question is wrong?
Pardon?
What if the question is wrong? You know, if you ask, explain why they have not received, and she's explaining that they have received, and this is what we give them.
Chair,
Yes, I mean,
because I am the one who wrote the question, it cannot be a wrong question, Governor. For a bit of background, Chair, you can see this is a very old question. We had a meeting with CHPs from Nairobi's 5 constituencies on 16th of December 2024. This question originated from those conversations we were having with them. As you can see, the question was brought before the Senate on the 13th of January 2025. This was out of the conversations we had with the CHPs themselves. Now, the question is not talking about masks. These people, you know the environment in which they operate in, including the informal settlements, and when it's raining, Governor, the way that it is raining right now, they are saying there are necessary tools for them to be able to do the job. Gumboots, raincoats, and gloves. So when they say we need these things to do our job, that question cannot be wrong.
Chair,
yes, Governor.
With your permission, the reason why I said it is wrong is because, and there's a standard of what is in the kit that is set nationally. This is additional. So it's the right question. Why don't they have now gloves, raincoats, gumboots, and masks? They are given case by case, depending on what they are sent. It is not given to all of them, because you see, they cover 782 households. That's why there are 700 and how many households? 782,000 households. That's why there are 7820. And not all of those areas throughout the year would require gumboots and gloves. Beyond the standard kit, because remember, there's what the national government is doing in the county. All counties are matching 2525. But Nairobi, we increased it. We're doing more. We're doing 35. Where there is need for additional, Chair, and the director will give more details, we actually provide. But it's not a standard provision for all of them at the same time. Maybe you can clarify. I hope I'm not wrong on that. That's from what I know, but just clarify.
Governor, you're exactly correct. In the case of what Senator has asked about the gumboots and raincoats, we did a procurement in November 2023 as Nairobi County government, and we were able to supply 1,200 of them with these commodities in response to the cholera epidemic, which we were able to control as Nairobi County. That was running then. We are able to give commodities, and particularly those around wash, and these are commodities around the wash response, to the CHPs whenever we have any outbreaks, and we do this with support from the county government budget as well as development partners. When it comes to the CHP kits, we receive this from the national government. We have accounted for that, and we have a distribution list of how these kits went to the CHPs.
Thank you very much.
And so,
let me help you so that in future you frame your answers correctly. You know, we are not asking for very complicated answers in the Senate. Why don't you just come to the Senate and say, you have asked about this, give us details and say, we have supplied 1,200 CHPs on this particular area, in this particular period, with the following commodities. Okay? There is no competition here. This is just feedback from the CHPs who are saying, we want to work for Nairobi County better. Some of these places are not accessible, we need gumboots. This, you know, just direct answers. You know, if you say under WASH program is a complete another different program. We cannot wait until there's an outbreak of cholera for us to supply them with gumboots. It's raining every day in Nairobi, you know. So what we are saying, I've had your answer, but please, you know, I can tell you, Governor, you know the problem with some of the answers we are given, and sometimes we sign them off. It starts with perception. You know, these questions are being asked because I'm being fought. You know, those things. Please, Daktari. You have good answers, but you see you have not collected your data well. Just provide data and evidence. It solves our work. In short, one look at your budget, one look at your procurements. You know your Nairobi very well. We know the season we are in the country, where they need to be facilitated with gambut, facilitate, and we agree with you. Not all places require those commodities, so give those who deserve, so they can give you a better service. Can you go to question number 2?
Chair, just before you go to question number 2, you know, there is an attitude from the Nairobi County government that they can be clever with words and they think we will not know what they are saying. Because what she is saying is they went out to buy gumboots after or during a cholera outbreak. You have a full complement of 7,400 CHPs, Governor. 7,400. You know their job description. You have sent them out into the estates to do this work. There are certain basic things that from the beginning you would think that they would require. That's the whole point. If even for you during the campaigns when you sit with these CHPs, the question of gumboots has always been there. From 2017 to 2022, you talk to the same people that I talk to. So the expectation is, if you can tell us of the 7,400, 4,000 don't need them because they work in I don't know which area of this is Nairobi that you think that they will not need gumboots, because when Nairobi floods, it's all over the place.
No, they're not on the...
That's what I'm saying. So you will tell us of the 7,400, we have provided 4,000 gumboots for the people who work in these specific areas because of the sort of hygiene issues that are there. If somebody asks for a raincoat, Governor, which ones will you give raincoats and which ones do you think even if they are rained on, it's okay?
Chair, it's such a simple issue. We shouldn't split hairs.
No, it's not a simple issue. The reason why we are splitting issues is because you've decided to split issues. The response that is coming from her, she decided to tell us that they bought 1,700. She needs to tell us for whom, as the chair has framed. So can we have a conversation? Are these things that the county government thinks are necessary for these CHPs to be able to do their job? And if they are, then we say only 3,000 of them need it. These ones don't need it. And if you can be able to give us that breakdown of what has been done. So unless there is another cholera outbreak, can the remaining 6,000 or so...
I think you have made your point, Senator Sifuna.
Gumboots.
Let me just allow some small clarification, then we go to the question number 2.
Chair, we'll give all of them.
That's enough.
If there's someone who has actually in your answered, the issue of even giving CHPs in Kenya a stipend was brought by me in this house. I believe in the work of CHPs. And we were the first county to give them a stipend. And our stipend is the highest.
Now you
so if something can give them, just allow me to answer. If something can make them work better, I'll be the first person to do it. We shall provide additional. What we said was the essential, the basic essential that's a national standard has been provided. We shall do more. I think it's a fair case, you know, and we shall do it.
Very good. Now let's go to question number 2.
Number 2 was the measures being taken to address technological support gap. Chair, long and short of this is that we have 7820 CHPs. The provision by, you know, these devices are being provided from the national support. They provided for fewer than they are. So there's been a push as COG because it's throughout the counties, it's not just in Nairobi, because you want standardized equipment. And so that procurement is being done at the national level. I think the support from one of the organizations, is it CIF or who is it? One of the...
Yes, it's CIF, yes.
Child Investment Foundation Fund are the ones that procured that for the national government. So they will bridge that gap for all CHPs across the country, including Nairobi. The next question.
So maybe, Governor,
yeah.
So how many were provided for Nairobi? Because then it makes it possible for us to make a follow-up with the ministry.
Yes, thank
because
you.
Because it's their work.
So 7,502 were provided with that, with the devices. The gap, therefore, is the difference with 7820. That's a difference that we... So it's been tabulated for each county, how many need to be done. We will be very happy if the Senate can assist and we can provide the list from COG for all the counties, because it's also not neat and clean and fair for them. You're working, one CHP has this device, another one doesn't have the device. Remember, the national government also got over 100,000 CHPs. There are more than 100,000 CHPs in Kenya. So that is why the gap is there.
Yeah, Chair, the question also covers the qualitative aspect of the devices themselves that have been provided. the conversations with the CHPs that it is old technology. Most of the time it's unreliable, it's failing. So maybe you can address that as well in terms of the quality of the technology itself to be able to do actual online reporting. Because when we were with them, the demonstrations there, those phones hang 90% of the time, Governor. And it makes their work very, very difficult. So maybe you can address that as well. Instead of buying the machine for chapatis, maybe we should buy iPhones for the CHPs.
Senator Sifuna, you are out of order.
Sorry, I didn't hear
That is a completely different program that doesn't even fall within the mandate of this committee.
What it is?
If he has anything to ask about school feeding, he should go to the Committee of Education.
No, it just shows that it is lunchtime. Something, anyway. Chair, you know this ICHIS program is national. The ones providing the software, the devices, some say even the bundles. And Chair, we have been insisting as COG and as counties, just leave that entire thing to counties to do, because we can provide software, we can then look at the quality of, it should be left to us. I'm glad I've seen what you passed recently, that you've put the entire now stipend from the national government as a conditional grant to come to the counties. Because even to the next question, there's no delay of stipends from the county government. We never delay, not even once. There's no month that they have not been paid. But the national component sometimes can take 2-3 months and then it comes in lump sum. But the county one has never gone beyond a month. Sometimes it might be late in the month. Because I said it very clearly that no CHP, or rather that I, as a governor, will not be paid before CHP has a stipend. We're on the same payroll. So I am paid on the same day, the CECs, the directors, and the CHPs. We're all paid on one payroll on the same exact day. So, again, it's something the committee can take up.
But I think that is okay. Now that we have put as conditional grant, it will all come. So payment.
But see, that's just the money. Now the software, the management, the scoring,
what we need to do now so that we can help you. I think now ask your chair of that COG to give us a report.
Oh, good.
So that we are now able to follow up. In fact, 2 things. So that we are able to help address that issue of CHP. Let us get the data on the number of CHP without the kits, so that we can follow up with the ministry to exactly provide. Then 2, the challenges they're having in terms of technology and so forth, so that we can follow with them up to upgrade. And your proposal as a COG in terms of it being left to you, so that we can still pursue the same trend of making that provision of resource a conditional grant, so that it can now be managed from counties. That's why there is need for collaboration between COG and us. But your chair hardly comes to any meeting called by the Senate, so you have to come persuade Senator Sifuna so that we make progress.
Governor, there is a question that I was asked to specifically put to you by those CHPs. They understand that the component that delays is from the national government component, right? And county governments, I think including yours, whenever the disbursement of equitable share delays, you have found ways to make sure that you pay your people. That's a fact. Why are they not included in the similar program so that you are able to pay them the full one, covering even the bit by the national government, and then when the money comes, you're able to deal the same way you deal with salaries when there is exchequer delays?
We can look at it for the government component when it delays. The only issue that I foresee we would have is COB approving that difference, but it's not a big amount. It's something we can explore, definitely. Yeah, so that we can cover for national when the money comes. But now that it's a conditional grant, again, the exchequer delays really hold counties back, But the covering for the national government 2.5, if COB allows, we can be doing it. And then when the money comes, we now take it back to our CRF for other purposes. But I think that's a very good idea.
That now you can explore that. Now the last question there.
These are things that we should even just be discussing, because it's such a good idea.
Don't make me make some comments.
This is why we want you to be coming to the Senate
to avoid
more often.
No, Sifuna has just said it, so let's be honest.
It's a good
The last question.
Chair,
Senator Sifuna.
these conversations cannot happen anywhere else, Governor. This is why we insist that you come here.
It's good.
We exchange ideas.
Thank you.
Chair, I wanted to say the same thing. I think Governor, being Senator Emeritus, I told him the other time he needs to use us, you know, I mean the health committee or whichever committee. He's been here before and he knows about, I mean, where we can support, where not. So I don't know why he's not taking advantage of us.
I think that's why he's here today. Now let's make
Can I also come on my own motion? Suomoto.
Yeah, you can invite us. The committee was wrong in having an engagement.
Yeah, because
you know, Nairobi carries 7 million people. It's a very significant population of of this country. Almost actually 10% of the population of the nation. So the health of this city is extremely important. So can we have a response to question number 5?
Chair, on question number 5. No, there was number 4. On why CHPs have been required to conduct SHA registrations for the public without adequate facilitation. That's an issue they have raised. It's an issue I've also raised similarly at COG. I feel that, you see, the 2.5 that comes from national shouldn't just be an assumption that then they take on any other additional task. Because, Chair, taking care of 100 households for one person is actually a task. And this network of CHPs is so critical, because they know this house has this issue of diabetes, this other house has this. So there should have been some facilitation.
But Governor, I agree there should have been some facilitation. But how about if we ask the CHPs, just in the 100 households they are taken care of, ensure the 100 households are registered in SHA.
That's what
so that as they go about their work, in terms of checking on these other things, they also make those inquiries. But I don't, of course, we are not saying they don't deserve additional thing, but I mean, it also enhances the healthcare, provision.
You know, Chair, this, things improve with time. When I came to this house, we had 15 billion. We left it at now 18. My senators pushed it to 20. Chair, CHPs were getting nothing. I brought a motion. We started as Nairobi. Now they're getting something 3.5. Ideally, CHPs should be at minimum wage, if you ask me, because they're no longer volunteers. They're actually workers. They actually do meaningful work. If it was up to me, we would have a conditional allocation to all counties for CHPs to be at a minimum wage, because of the work they do. Then you can give them different tasks. The same way, my staff here, yes, they have their JD, but I can give them different tasks alongside health because they have a full salary. So that would be our proposal, Chair, moving forward, that CHPs actually moved to minimum wage. The next question is efforts to enhance training for CHPs on use of electronic community health information systems to ensure efficient reporting and awarding of marks. Chair, we have the CHPs report to CHAS, Community Health Assistance. We have employed additional, we've promoted actually some of the CHPs who've shown leadership. They've shown ability to manage teams and to train others. So those ones have been promoted to actually be employed as community health assistants. These ones are now as county employees. They're trained on the system, and so they serve as the supervisors. They're providing mentorship, coaching, training on niches to CHPs on a day-to-day basis. Chair, in one of the mental health, trainings that we had with the CHPs, and I tell you, I really love the CHPs. One of them said that their stress goes down because I'm in their WhatsApp group, and when they raise issues, I can see. Such things actually help us, because mental health is big for them to be, at a good mental space, and that is what Dr. Kunu told me that. I hope it is true. Yeah, but I'm on the WhatsApp group with them, and that's what they said. And so I think that brings us to the end, of that question.
Thank you very much. Now we have two statements that are related. The statement by Senator Amida Kibwana and Senator by Thabeda. All are dealing with Mama Lucy. And they are not, because Governor, we want to try and dispense with this so that new statements can find their way into the House. Can we have responses? And I think these can be handled together. They are more of similar questions. We can have just a comprehensive response of the two questions by Senator Amida. The question by Senator Mutinda is on state the total number of women detained in the hospital facility due to inability to settle maternity fees, stating the respective amounts owed, state the payment modalities or options in place set by the hospital management for defaulters, explain the protocols followed by the hospital management in the event a patient is unable to raise maternity fees. The one for Senator Mida is asking for a report on the extent of overcrowding and strain at the Mamadusi Kibaki. Outline measures taken by the county government of Nairobi to address overcrowding, and then clarify the steps being taken by patients are not unfairly charged for services they are unable to access due to current constraint. Recommend measures on how the national government and the Ministry of Health can support the county government of Nairobi to improve. I think those, since you have written responses, you can give us just a whole summary of you and just allow senators to ask if there's a specific question they want to deal with.
Thank you, Chair. And Chair, I agree. Now that we'll exhaust all of this, and I want to commend your clerk, Humphrey. He has found a way to be able to communicate better with our county, such that we don't have the backlog that we had before. And so whatever comes to this committee, Mr. Ringera, who was my campus mate, will be able to make sure we dispense with very quickly, Chair. Chair, the issue of detention. Number one, we don't detain women in facilities. It is the waiver period and process that takes a bit of time. And that is what we were refining. Because you find people ultimately, and you've been a governor, facilities cannot run if payment is not made. And that is why we tell people, please register onto SHA. Register onto SHA so that you can be covered. But you see, also keeping them for long is a cost, because you have to feed them. They're taking space others would have taken. But imagine if everybody who says they can't pay is released immediately. All facilities will collapse, Chair. If people had the option of not paying, they will not pay. Even those who can pay. So, Chair, we have a waiver guideline, and we have a process of waivers, partial waiver or full waiver, that hospital by hospital we do. Chair, when I go to those hospitals, and the CEOs will tell you, even those who could, all the women, they come running and they say, oh, Governor, tumekwama hapa. Sometimes it is not true. They say there's been there for 3 months. It is not true. I don't waive for them. I pay. The only difference is, Chair, I don't put it on media. And I think people should stop carrying cameras to hospitals. You're going to see someone in a hospital bed, you're there with their camera, you're looking at their leg. It is very indecent. It takes away the decency, of that patient and the dignity of that patient. You must respect their dignity. So, Chair, that's the waiver system we have. We will keep on doing campaigns for health insurance, because health financing is a critical aspect that this country needs. And I'll tell you an example. Today, in my level 2s and 3s, my primary healthcare facilities, I think I will invite you to come to Embakasi South or Embakasi East. You can go to Tasia. We can go to Kware dispensary. Kware is now level 2. All my hospitals have assigned, you walk in and walk out. If you're not registered, we register you there and then. Because PHC fund, imagine that hospital that was just like 2 containers is getting 1.7 million shillings a month at the minimum. The PHC is working perfectly. The problem we have is on the level 4s and 5s because of the SHA reimbursement that is taking a bit of time. But for the lower levels, and many people are also not being told, and I'll ask the SHA team, I think I saw the senator here, the CS here, and the CEO, to explain to people that you don't go directly first to the level 4 or level 5. Because those who go there are the ones who say SHA is not working. Because it is based on a referral system. You start at the lower level, and then you're then guided on where to go to. Those who do that have a seamless experience. I know people who've been paid for 300,000, 400, 180. In fact, the number of harambes that we are being put into for health have actually gone down drastically. So, Chair, on the issue of bed capacity, again, a city of 7 million people, the bed capacity required is tremendous. But I keep telling my CEOs, they have become victims of their success. People are coming to our hospitals because they know that is where they're getting good care. And that is why they're flocking in there. So we're continuing with infrastructure improvement, building more wards, hiring more doctors and nurses, because you must give that care. But the policy is you cannot turn away a patient. If a patient comes, you cannot tell them, no, the beds are full. please, and that person is maybe even critical, or they're about to give birth, do you turn them away? You don't. But the turnaround time is high. And that is why, for us to prevent that, those who have been cleared with are discharged as soon as is possible. We have those infrastructure projects. I have shown you Mutuini, which is going to have a huge bed capacity. Is it 300 or what? What is it? Mutuini? Mutuini, which is Mamarecho Ruto. Mutuini will have 400 bed capacity. Mama Margaret is also big, 425. Mama Lucy, this facility that my senator was talking about, is adding an additional 120. And also there's another 300. So we're expanding. What I would ask for the support that Nairobi County needs. Chair, in the same way, we saw that in education, Nairobi needed affirmative action. That a county like Nairobi from 1992 had no new school built. With 7 million people, had only 210 primary schools. You can compare with your county. You know how many primary schools you had, because my guest of honor on that day was a former MP from Eldoret. Was in Gishu, Eldoret, former Eldoret North MP, who is the president currently. And he said when he was an MP, he had 150 schools in his constituency. Nairobi with 17 constituencies had only 210. The same affirmative, and because of that, they did affirmative action in the budget, added 1 billion every year for 3 years through the members of parliament to build classrooms. It's the same way Nairobi would require affirmative action to increase bed capacity in public hospitals and public hospitals. Beyond that, we will have the same story of women sharing beds. We increase the number of beds. We cannot turn them away, Chair. Chair, I think that generally covers.
Maybe one question,
capacity.
because I visited Mbagathi and your CEO is here. There's a very big facility that was left by COVID in Mbagathi that was not in use. Bwana CEO, is it in use? Ama wasasa umangoa?
Honorable Chair, it's not in use. We engaged the public health sector, and that space has been condemned. But we are putting it into a better use of a center of excellence in maternal and child health.
Okay, Senator Onyonga.
Thank you.
Thank you, Chair. Governor, my question, I don't know whether Chair, I'm preempting what you wanted to raise. I'm just interested to know, how has your FIF performance been? Has it been increasing? And in your responses to the questions I've had, which have been asked, I just heard you say the national government is doing this and this. Other than the constructions you've done and the projects that are standing, how much is your FIF helping? And as I said, has it increased? Is there a variance and that kind of thing?
Senator Amida.
Chair, you realize, I think, Nairobi, I think it's long overdue, Chair. I would just propose for us to go for inspection, simply because just to support all that. And you remember, even these questions, actually, I think we haven't seen Gava for some time, because these were since 2024. But one more thing, Governor, there was a motion that went through, my motion on postpartum depression, having a mental health wings. We've gone to many hospitals, and I think, of course, Nairobi being one of them, that you find mothers who they have lost their babies in the same wing with the ones who are breastfeeding. It's really, they fall through, they go through depression. So mental health issues. And I said, I'd requested, the postpartum depression who are going through that, can we have a separate wing for them in every, county for them? And then number 2, yes, inspection. Then one last thing, Bwana Governor, let's take advantage. I think we've been having even many investors who have been interested to build hospitals. I don't know whether they've approached you. So in case we have, and maybe we have been having many proposals on that, why don't you take advantage? At least the legacy for you in Nairobi is healthcare. You know, health is wealth.
Yes,
so let's take advantage of that.
Governor, 1 minute response.
Thank you. Chair, I agree. I agree with Senator Hamida and also Senator Onyonka. Number one, we have to be creative. There are many partnerships that we've sought now. We're working with the Swedes or Novo Nordisk guys for the Danish, sorry to their country, on the issue of diabetes, and you'll have a center of excellence. The first research hospital public research hospital is going to be Mbagathi, working in partnership with Kemri, so that even these who are doing great medical research can do their clinicals within our hospitals. Chair, if you look at Mama Lucy, now it has an annex in Umoja that is the first public eye hospital where we're even doing admissions, we're doing surgeries. That had never been done. We're manufacturing the spectacles from there in Umoja too. And I would wish you come see it. There was an old man, and I always give this story, 91-year-old, he had not seen for 50 years. He went to Umoja too when we were launching. We gave them 1 month of world-free services. He regained his sight. And he started saying, I'm not going to leave this hospital. Because he felt if he leaves that fence, the sight will go back. That he's only seeing because he's in there. And you could see him asking his son, Kumbe, you look like this, I thought you were more handsome and whatnot, joking. And there are many such stories. Regaining sight, now you're finding people from all over the country are coming to Umoja too. They know the matatu to take to reach Umoja too because of that eye hospital. I've talked about dental services that we've increased across the county, and dental chairs that were never there. Many of us never went to a dentist growing up. We thought that's for rich people, God has helped us that we can still smile, But there's such transformation when you change governance. On PPPs, we're working on one currently in Isili. Isili, we have beautiful land, big space, abandoned facilities. Investors have come and said, look, we want to partner with you. We put up a hospital, public hospital to the level that you want, and allow us also to have our own private wing. It makes sense, We need to do the same for expansion even of the Nairobi Funeral Home. Because the same quality today you're going to get at these private facilities, whether it is Montezuma or whatnot, let me not mention the brands. Today, if you go to Nairobi Funeral Home, remember the smell that was always at that roundabout. Always. It has improved tremendously. It's called Nairobi Funeral Home. What formerly known
is the generator working?
Formerly, there are many generators. They are working. There's even now a chapel.
Now let's make progress, Governor, because we have one more statement
on the final one.
That's finalized. That's what
FIF. FIF is extremely important. One aspect that I raised, because I called all the facility heads to chat out City Hall, and what one of them mentioned made so much sense that now they have to do accounting work that they were never trained to do, because they have to account for all this money, and we have now been taking them to courses, training them on these financial management skills. There is a no cash policy, so we've sealed the leakage. The FIF has gone up. There's no cash policy. All of it is paid through the system and retained at the facility. That's why I could give you the example of Embakasi South, a small level 2 getting 2 million shillings a month. Now the story of shortage of drugs is a long forgotten story because you have no excuse. And the Wananchi's interaction with the hospital to know whether it's working or not is not whether there's a doctor. They never know whether they see a doctor. Actually, most Wananchi don't see a doctor. They see a clinical officer. If they see someone in a lab coat, that's a doctor, But of course, we have doctors in our facilities. The test, the pudding in healthcare is kama kuna dawa or if there's no medicine. And once that is sorted out, we are seeing the public now, more of them coming to our facilities, Chair. Chair, I can leave it at that.
Excellent.
Yes, Senator Onyonka.
Governor Sakaja, if you to listen to what you've said, and I remember I've attended functions, committee meetings where you've sat up like this. I live in Nairobi and I don't know what you have said is true. So is it possible, Chair, if I could make a request that you allow us at least for us to go and verify that what you're saying. Because if this is what you've done, then I don't think we should have much issue.
Senator Onyonka, we don't need the permission of Sakaja to go to any facility.
No, what I'm saying, Chair, is that in case he's going to have the by-elections, you know what I'm saying, he might think we are going to look for votes. So we just want to visit.
The facilities are spread across
The 60 other sub-counties that don't have a by-election.
Yes. Now, members, because we have only one statement from Senator Okiomtata, I've gone through the statement, and I think we can still dispense with this statement before it is 2:30. I think we shall have cleared our books with the county government of Nairobi. So I'd ask Governor. A statement was sought by Senator Okiomtata, the senator from Busia, and I have seen the team from Bagadi were here. I think this can be adequately addressed. I've also gone through the responses. There was an allegation of abuse of medical bill waiver facility at Bagadi County Referral Hospital, including involvement of hospital staff management in the said malpractice. Then number 2, the veracity of allegations of threats, intimidation against staff and patients and their families, and indicate measures in place to guarantee safety and protection. Then number 3 is audit of collection of parking fees at the said hospital, determining whether due process was followed in the introduction of the charges and clarify how funds collected are utilized. The mechanisms the Ministry of Health has put in place to monitor and ensure proper administration of medical bill waiver facility in public hospitals across the country. But I think if you reframe that within Nairobi County, you tell us what you are doing about it. And then number 5, whether there are regular audits of public hospitals specifying whether Bagati County, I think the rest of the audit we shall deal with the ministry. But we also want to know from the departmental level of your county government, do you do regular audits to your facilities? So I think if we can get those responses, I can see the CEO is already positioned himself. Governor.
Yes, Chair, I'll just give a general overview and the CEO can quickly run through it. Chair, our intention, as I've said, is to enhance autonomy of the hospitals, especially the level 5 going up because of the potential that they have. Chair, a hospital ideally should run itself. If you go to any private hospital, even if the charges are a bit higher, they run itself. Lab is profitable, you know, the issue of medicine, etc. And that is where we're moving to without overcharging the patients. And Mbagathi is one example of a center of excellence in the country. In fact, the CEO has been receiving delegations from other parts of the country to see how certain things are being done, and he can be able to explain that. I think the last team was from, was it Nakuru, on the issue of neonatal ICU. So, Chair, the waiver process has been outlined, and we've given the sample waiver forms and the process that is undertaken to provide the waivers. The issue of intimidation, and you know, we needed more information there. The answer is that the allegations are not true, but the hospital has an anonymous incident reporting system, and we encourage, and that guarantees safety and protection of whistleblowers, including, you know, if something must be escalated at City Hall, there is actually provision to write directly to me, and I'm the only one who opens those letters. No one else opens those boxes. I'm the one who personally goes around to open. The audit of collection of parking fees, whether due process was followed, introduction of charges. Chair, we have 2 hospitals where we have to introduce parking fees because people would come, leave their cars, and then go to town. And so patients or people who need the services don't get, you know. So Mama Lucy Hospital, which now the parking was full throughout, of people who are not seeking services, including even sometimes matatus, you know, previously, as well as Mbagathi Hospital, that has had to be introduced. But those are both
before you leave there, so that because we are short of time. Now, those parking fees you are collecting in Mama Lucy,
yeah,
and Bagade, I hope the revenue is going to the hospital.
FIF direct.
FIF.
No, not to the county.
Yes.
That is FIF. They did a revenue share model with the person who installed the equipment.
That's okay.
So
as long as whatever is due is remaining in the facility.
And soon I told these CEOs of mine, I will stop paying their doctors and nurses. They must take over that payroll. So we are seeing the growth of these hospitals. These hospitals can actually stand on their own. Once SHA is fully, you know, the reimbursement is guaranteed on time, we can be able to move all of this stuff to the payroll of the hospitals, so that we can have, them as almost level 6, but not in terms of speciality, but in terms of autonomy. So CEO, whatever I might have left out, kindly.
Chair.
Why don't we allow the CEO to finish what we can discuss?
Okay.
Thank you, Excellency. I think, Chair, Honorable Senators, I have nothing to add. His Excellency has addressed everything.
Chair.
Madam CEO, that's a joke of the year. Now, there are only 2 specific areas the governor has touched on. I expected you to tell us something about the issue of audits, whether your facility has been audited. Do you have any report? I also expected you to tell us that now that this revenue is coming, how are you utilizing?
Thank you, Honorable Chair.
And on the issue of, I don't want us to wish it away, Governor. On this issue of allegation of malpractice, I think you must speak to it, Pana CEO. It cannot just be, Senator Okia Mtata is not an ordinary man. And he's a lawyer who is not trained. And he does extensive research. By the time you see a statement, just know there is information. So I think clarify whether there have been such incidences before they have been dealt with, and what is the position. I think that one line sentence is not sufficient.
Honorable Chair, well guided. On alleged abuse of the medical facility, the response is false. It's not true. There are controls to ensure accountability in the process. And to achieve this, Honorable Chair, is that the medical facility is managed by a standing hospital committee, which comprises 1 medical social work in charge, the ward in charges, these are the nurse managers, the overall nursing services manager, the hospital administrative officer, and the hospital accountant. Honorable Chair, Honorable Senators, the beneficiaries of this facility are identified among both outpatients and inpatients, and mainly include patients not registered with SHA, street families, gender-based violence victims, patients without social support, mostly from slums, and the wrong-state discharged patients. Honorable Chair, Honorable Senators, the nature of these waivers are in 2 categories, namely full waivers and partial waivers. Roman 1, full waivers. These are patients who cannot raise any amount to offset hospital bills. Roman 2, patient waivers, partial waivers. These are patients' bills partly paid by SHA but cannot raise a balance, or the patient or the guardian able to raise a percentage of the hospital bill. In this case, a favorable amount is paid directly to the hospital account, and an official receipt is raised, and the remainder of the bill is waived. In both instances above, Honorable Chair, the committee determines the applicable criteria through a vetting process in partnership with relevant community health promoters, area administrators, mainly chiefs, religious leaders, and political leaders, mostly area MPs and MCAs. Once the waiver committee makes a determination on either of the above, an official waiver form is issued to the beneficiary bearing patient's information, signatures which imply approvals of the committee membership, and a record of the beneficiaries is filed and kept by the Hospital Medical Social Work Department. After the management executes this process, it is subjected to the Hospital Board of Management on quarterly basis for audit of the process and ratification. Question 2. The veracity of allegations of threat and intimidation against the staff. Response. The allegations are false. The hospital has an anonymous incident reporting system that guarantees the safety and protection of whistleblowers, and this is addressed by a committee who opens the boxes and analyzes issues raised. Question 3, Honorable Chair, Honorable Senators, an audit of collection
The department. Let us not go far. Waziri, how many times has your department audited your facilities? When was Mbagathi last audited?
We audited Mbagathi last year. That is the year 2024-2025. The audit is currently going on. We submitted the 2023-2024 to the county assembly as well. So it's audited annually.
Thank you very much. Senator Onyonka.
Chair, thank you. I just have two small issues. The MD of Mbagathi Hospital, I don't know whether it's, yes. I wanted to say that thank you. Chair, I've had cases of my people from Kisii who have been having challenges with the treatment of certain diseases, and he's been extremely very welcoming. And I've also seen your facility, two recommendations, and Governor is here. Governor, I've noticed that many of the projects we do, either as a country or as a people, we never keep any maintenance money or maintenance teams to clean up the facilities and keep on repairing them as we use them. I don't know what you are going to do about that. And the final one, I sit in the finance committee, and one of the recommendations that was given is that we need to have internal auditors in all these facilities that you're running, who will be having frequent audits in order to try and manage and control the use and the management of your facilities. Otherwise, Chair, thank you so much.
Before you respond, Madam CEO, I've looked at the revenue sharing agreement for parking. We are only getting 30%. Why? And for how long? When is the revenue sharing going to be 50-50? 30% is on the lower side.
Thank you, Honorable Chair.
Let's Senator Kamau, so that you can respond to all of them. Senator Kamau.
Yes, thank you very much, Chair. I wanted to ask the Governor, now that we are in the process of encouraging people to register for SHA, I just wanted to know what is the number of registration of Nairobi County, the people that have registered on SHA.
You can respond.
Thank you, Chair. As I get that number, the CEO has mentioned, and the question that has been asked about the quality of the service. I'm glad Senator Onyonka's people go to Mbagathi. I want to tell you, Chair, I myself have been treated there, and my father goes for physiotherapy there. It is at the same level as any other hospital you'd go to in this capital of Nairobi, whether it is the private ones which have been known for a long time. The level of quality I got there, in fact, the doctor who saw me, what was his name?
Dr. Masini.
He is one of the best, you know. What his specialty is in orthopedics.
Orthopedics.
As in orthopedics, I had an issue where I fell from a motorbike, but and don't ask me the context. But because I ride bikes, he treated me so well that I've kept going. My dad does his physiotherapy there regularly. He leaves Kitale, comes to Nairobi, straight to Mbagathi, and he says he doesn't want to go to the other hospitals I used to take him to. And we need to encourage that use of our public facilities, especially by public officers, because the same quality I expect my person from Kibra, which is next to Mbagathi, of medical care to get the same quality that I should be able to get for myself and for my children. Now the problem with the children, they're not ours alone, they are mothers, and the mothers have their preference. But it was up to me. Even my kids would go where I go to, because I'm a patient at Mbagathi, I have it over there, and at least I have my personal doctor. Chair, the issue of maintenance is important, which is why, and now we're moving to the level 4s. The introduction of CEOs in level 5. A CEO looks at the 360 degree of a hospital. From how does the gate look like? How is the signboard? How does a watchman speak to Mwananchi when he comes in there? Are they welcoming? Is there a reception? Is there a signage that shows you directional mapping? Doctors are good, but they focus more on medical and clinical and technical issues. So that has helped us do some, well maintenance. If you come to those hospitals, you will see the gardens are taken care of. The quality of paint, the aesthetic, even the aesthetic value, the food. They look at what the patients are getting, etc. And we've seen huge improvement. And now at the level 4s, we're soon advertising for also those facility heads of that nature that can look widely, because our level 4s have realized in Nairobi almost like a level 5 elsewhere. because of the sheer number of people that they see. So that is what we intend to do.
Thank you, Your Excellency. Honorable Chair, the sharing formula was determined after several considerations. We sat down with the FEDA and we also worked on his return on investment, and we have transferred some risk to him, like other than the installation of the machine, he is doing the maintenance of the equipment, including updating of relevant software and other physical infrastructure, ensuring the parking area is clean, and such other things. So it will subsist for a period of 3 years, then we'll do a review. Honorable Chair, thank you.
Thank you very much. At least the period is fairly good. So, Senator Kamau, there is only one more question that asked about how many people are registered in SHA in Nairobi County.
Yes. On SHA, we have 2.9 million people now registered in Nairobi. That is 42%. And so we keep telling them *147# register, join SHA. Even the short code has the county number of Nairobi, 47. So we are the biggest champion because it's really helped our facilities, especially at the primary level. Chair, just as a by the way, or maybe as a diversion, when we are here, people are watching us, and somebody has sent me a message asking for money to go for radiotherapy at a private hospital. I want to tell him it's called Tobias, go to Mbagathi, and you will receive that service the same way we're being treated there. I've just seen that message on my SMS, Chair. Chair, we humbly submit.
Thank you very much. Maybe, honorable members, if there is anything else other than what was on the statements. So thank you very much, Governor. The last time we made a visit to Mbagathi and the Nairobi funeral home, and the funeral home was not in a good state. All the generators were not working, all the fridges were not working, so I hope there is improvement.
Chair, in fact, one of the issues we had asked was, Governor, I hope you've solarized all your health facilities.
Not all of them. Solar is expensive, so we're looking for partners. The initial cost of setting it up is a bit high. So we've been able to do some markets. We are looking at the facilities if we can do through FIF, because we don't want to pump in more money in hospitals while they're actually receiving money. The markets don't receive money, that is comparable.
So I was just saying, Governor, when we visited the Nairobi funeral home, there was a huge problem. So maybe just in a nutshell, tell us the improvements we have done. We noted that the generator was not working, the fridges were not working. We had also issues of staffing in that place, and I'm happy now that KMTC is now training mortician. One of the problems that we had was it has to be training on the job. But now KMTC is training personnel, so I don't know whether you have improved the number of personnel. The few are there were complaining about the workload. And the other thing that was a problem in Nairobi Funeral Home are unclaimed bodies, and also bodies that are brought by the police. And I actually made a recommendation that there is need to have a separate problem mortuary because of the nature of Nairobi and the issues of crime and all these unclaimed bodies. It is completely necessary to have a separate mortuary to handle issues of police, because the bodies are kept there for years and before the matters are concluded, and if they are mixed with the regular bodies where families come to take, those staff there specifically made that request that their work would be made easier if they are dealing, with the issue of normal bodies from facility and so forth. But the ones that have police issues should actually be kept in a separate place. So maybe you can just make that. But I just want to say thank you very much for. Yes, Senator Amida.
Just a second, just one question. I was just wondering on mental health. Do the morticians and maybe all the people that handle these bodies, are they taken through mental health? I mean, are they taken through counseling and all that? And one last thing, it is really important. But one last thing is that about medical equipment. I hope all equipments, working at this time. The medical equipment is quite thorny. It, Gava. Thanks.
And I encourage all of us who are here, for purpose of mental fitness, it's good to once in a year you visit the mortuary. It wakes up. It will help you wake up to the reality that do something when you are still alive, because
Chair, when you see my CEC who's next to me, who is the youngest CEC in this country, when she became CEC for health, I told her the first thing she must walk through the city mortuary from one end to the other end. And she was at first timid but became very bold. Even I got used to it. I think I've gone there more than any other leader in this city before. And I keep going. If I pass by Bagadi, I always pass by the funeral home. I know those young ladies who you met. At that time there were 14 of them. We've onboarded them. They have come on board. We've hired also some casuals. Senator Hamida, morticians love their job and they really enjoy their clients. Their clients are not rude. The clients don't complain. They don't talk back. If you ask doctors, the chairman of Nairobi Funeral Home is Dr. Johnson Sakaja, who is one of the highly acclaimed morticians in our country. And if he tells you stories of what he's dealt with, it's a calling. You know, when I was in Chiromo in campus, the medical school students would also start in Chiromo and our school of math. And in first year, many would drop out because they start with pathology, where you have to go work on the cadavers. By the time you've gone through that and you end up working in the funeral home, it is something that you're good with. But I hear you. If actually for all our staff, wellness is available for them. It is in the insurance cover. We encourage them, and we have our own county councillors. One thing we realized was many counties, and it's something we dealt with when I was here as chair of labor. Many counties didn't have in their schemes of service provisions for clinical psychologists, psychiatrists to be hired. So many counties didn't have that component. We changed that, and even as Nairobi, we've had very many, counselors, psychiatrists. In our facilities, you find that service available. And I want to encourage senators here and colleagues, because Chair, in the first time I was here in 2013 as an MP, we didn't have that in our medical scheme until one of our colleagues had an issue. And when she had this issue, she stormed the speaker's office and said, why is it that my psychiatrists cannot be paid? Because they are not on insurance. When that was introduced, it became the highest sought service by parliamentarians. So I hope you're also taking it, because it is okay not to be okay. And we did that book last year with them in the last Senate with Senator Sylvia Kasanga about mental health. Chair, on the issue of Nairobi Funeral Home, by the time we went there had been a challenge with the coolers. We've increased the number of coolers. There are 10 new coolers in Nairobi Funeral Home. The issue of disposing bodies has to go through a court process. We have to go to the courts to allow us, and we put the list in the paper. It's very expensive. But in the last financial year, we've been able to dispose 1,000 bodies from Nairobi Funeral Home. I really like the idea that you've given, that a special facility be set up purely for those cases that are from crime or police cases, etc., because they are treated differently. And that's a conversation we can have, because it reached a point that my chief officer refused to receive bodies from the police, and now the bodies were kept in a truck. Now the police boss tells me he has no mortuary. What does he do? Because they don't pay. For all other people, there's a payment that is done. But for the cases that come from the Kenya police, they do not pay. And so we said, let's find an arrangement between ourselves and the national police, because they don't provide such health services, but they can help us construct, or we can construct a facility that those cases can be dealt with in the manner they're dealt with. And I want to thank you for that idea. The issue of medical equipment is something we chose as a city, as a county, not to rush into it. There's a national equipment program, which is a good initiative. We had earlier the MESS program, which became a mess. So 45 counties signed. Nairobi didn't sign, and Kiambu had not signed, because we wanted to look at the detail of each contract and what we're already receiving. in some of the instances, we had better deals in terms of the revenue share of placement. We have since been able to negotiate. And so what we are signing as Nairobi, and I have already authorized for us now to sign, is a specific tailor-made program based on what Nairobi needs. So that you don't sign for what you don't require. Remember, there are counties that had signed, they were being charged, the money was being withdrawn from COP, yet they don't have three-phase electricity. So they're not using equipment that they're paying for, or they don't have water connections. So just being prudent and making sure that we get value for money. It has taken us time to refine all of those contracts and to have a tailor-made requirement. You'll find there are certain machines that are needed in Eastlands, maybe near Dandora. You'll find more respiratory issues than in Dagoretti. There are certain issues that are actually, in as much as Nairobi is small, there are very different ailments. Mbagathi has a huge population of people coming from Kajiado that come to Kajiado County, that come to Mbagathi, and what they come for is very different from what people are being treated for in Roysambu. So in fact, that's why I have found land to construct a proper level 5 along Magadi Road. So the Ongatarongai population, which I still consider my population really, because they're here throughout the day, they just go there to sleep, can also have a fully fledged level 5 facility along Magadi Road, just after the Catholic University. So Chair, yes, these improvements are being made day by day. We are not yet there. We are not perfect, and no county is, nobody is. But I'm very proud of what this team has been able to do. I'm proud of my team. And whenever they have challenges, they come and they consult. We've made great strides. I think the ICU example was a very stark comparison. From zero to the numbers that we have, we need more. But we will put together a proposal, Chair, that I will present to your committee on the affirmative action that Nairobi needs with respect to healthcare. And I'm sure that you'll be able to support us. Thank you, Chair.
Thank you very much, ladies and gentlemen. I think we stop at that. So this meeting stands adjourned. We shall be visiting, definitely. And Governor, most of the time for purpose of Nairobi, because we are all usual residents of Nairobi, sometimes the requirement of notice is not necessary, because it's about service delivery. So we shall be making quite several impromptu visits to your facilities. And our work is to give feedback on what needs to be done to where. So just take note. Mbagathi, of course, Mama Lucy, from the last report we had asked you to take some, the recommendations we had made. So we are also coming there to check whether you act on our recommendations. And that entirely lies on the facility and the boats. Otherwise, ladies and gentlemen, thank you very much.
The only issue of notice is not for time, but so that you have the right people. Nairobians, you can find someone and he says he's the CEO, yet he is there for mental health issues. And he takes you around and gives you a report. So just so that you have the right people in the right hospitals, just tell us, even if it's one day.
No, we shall tell you, but it will be part of mental treatment. Not walking around will also be a way of relieving pressure. Asanteni sana.